Hello everyone, today we will be explaining about geriatric radiography, care for the elderly. So, firstly, what is geriatric? Geriatric is a branch of medicine dealing with aged people and problem of aging. In Malaysia, geriatric patient classified as the patient that age 60 years old and above, which is we call it warga emas. So now, do you get it? What is geriatric? Aging is an irreversible decline in organ function, even in the absence of injury, illness, or environmental risk.
Next, we will focus on changes and consideration for a geriatric patient. First, we will look at cardiovascular system. So for changes that can be seen, such as cardiac reserve is diminished, leading to decrease in performance under stress. Blood vessel will also lose its elasticity. Peripheral circulation will also decrease, leading to increase in risk of injury, especially in lower extremities. Patient will also tend to feel dizzy and syncope and fatigue. For consideration, if patient was lying down, give patient some time to relieve their dizziness by sit up for a minute before standing to allow the stabilization of blood pressure. Be careful when positioning patient to prevent any injury. Be specific when assess their cardiac status by asking questions such as, are you tired? Are you comfortable? Or can you continue with more X-ray images? Next, we'll move on to respiratory system. In this system, changes that can be detected such as decrease in lung distension, especially during inspiration. Lungs become smaller compared to younger patients. Patients who are on medication will have slow and shallow breath. However, these changes can be coped by geriatric patients who are healthy. However, if stresses place extra demands on the body, patients will be affected. For consideration, we must always monitor for patient signs of shortness of breath. We must also monitor patient's pulse rate, change in skin color, and their effort to breathe. In between examinations, give patients some time to rest because geriatric patients tend to feel tired throughout examinations.
Next, we will move on to gastrointestinal system. For the changes in this geriatric patient, the first one is chewing food becomes difficult since their teeth might be worn or missing. Next, they will have decreased taste and smell sensation and cause reduced appetite. They will also have slowed peristalsis, cause constipation and reduces fluid and food intake, and slower gastric emptying cause early fullness. For the consideration, there is increased risk of stool infection and bowel obstruction. Therefore, when performing imaging examinations in the abdominal region, ask the patient about their bowel habits and last bowel movement. The radiographer should be especially diligent with post-examination instructions for barium and other contrast studies because of the probability of constipation. Next, we'll move on to renal and genitourinary system. For the changes in geriatric patient, the bladder loses tone and the ability to expand, and pelvic floor muscles and the urinary sphincter weaken. Next one is their kidney mass decrease, and there is often atherosclerosis of renal artery. And the last one is benign prostatic hypertrophy in many male elders can lead to stress incontinence or retention frequency and nocturia. For the consideration, the radiographer should take note to provide adequate hydration and note nephrotoxic drugs. Next, they will also should assist this patient if they want to urinate and provide a commode or bedpan urinal if the toilet is too far away. And the last one is we need to alert for symptoms such as confusion, lethargy or dry tongue.
So, what changes happen in endocrine system in an elderly body? When a bacteria causing infection attack an elderly body, the response is quite delayed. More worse, the infection are more likely fatal than in younger adults. The declining function of endocrine system in an elderly body also diminish ability to respond to physiological stress. Firstly, the radiographer must abide by the universal precaution so that there is no infection or cross-infection happen throughout the procedure of an geriatric patient. So, what is the consideration and measure that should be taken by us, the radiographer, when we are treating an elderly patient with declining endocrine system? As elderly patient is more susceptible to infection, the radiographer must always wash hands between patients to avoid any cross-infection or cross-contamination. Next, they are also needed to assist patients to wash their hands. Next, we must keep the equipment clean, as in the equipment that come in contact with the patient, especially the X-ray table. Lastly, we should adjust the environment to reduce physical and physiological stressors to patients.
Next, in integumentary system, changes associated in geriatric patients include their hair will become grayish, their nails will become thick and easily split. They will have thermal regulation problems, which associated with less tolerance of extremes of heat and cold. Their skin will become drier, fewer sweat glands, and show benign skin lesion, and their skins will become thin and fragile. Next, in terms for the considerations, so first, always be careful in turning or lifting the patient. And next, when transferring a patient from a wheelchair, elicit the patient's cooperation and inquire how he or she moves best. It is easier for the patient if the movement initiated from the largest nearby joint, and also make use of support devices such as walkers and canes. And lastly, all the patients may need blankets for warmth because X-ray rooms, tables and image receptors are often cold. So the radiographer are responsible to provide blankets to the patient to provide comfort.
Next, we have neurological and sensory system. The changes associated in geriatric patients in this system is their brain size and weight will become decreased, and they will have loss of senses. The first is they will have vision loss, and they will have hearing loss, which result in difficulty in understanding verbal communications, and the ability to taste and smell will also gradually diminish. And in terms of touch, the sensation of pain is altered, and the usual signs and symptoms of pain may not be present. Next, for the consideration that need to be taken by the radiographer, that associated with the sensory changes in geriatric patients is first, vision and hearing loss may interfere with learning or following instructions. So the radiographer need to describe the environment and ask whether the patient can see the objects. Next, avoid shouting, lower the pitch of the voice and use gestures, pictures and diagrams, and always be patient, speak clearly and establish eye contact. And next, assess the patient's understanding by asking them to repeat what was said. And lastly, be especially careful when asking all the patients to step on and off equipment because they may misjudge the distance to the floor.
Psychosocial change in geriatric involve loneliness, anxiety, depression, neglect of self-effects resulting from loss of family members and friends. Next, it also contribute to loss of self-confidence and lack of social support and network because of loss of commitment in society because of retirement. It's often coupled with the broad-term, long-term physical health such as Alzheimer, dementia and other physical conditions. So, for the consideration, we have to be compassionate to patient by exercising touch, by touching the patient hands or shoulder to show emotional support. We also have to taking time listen to their explanation and communicate in inclusive and respectful way. Speaking slowly, directly and distinctly when given instruction is the best to make sure them follow the instruction in better accuracy. For the musculoskeletal system, the change in musculoskeletal system always involve the occurrence of fracture due to loss of bone density. The most affected included femur, hips, radius ulna and vertebra. The loss of density in vertebral column and the disc that lose the fluids and become thinner make the spine shorter. When the spine is shorter at the cervical level, they tend to bend and resulting in choking or difficult to swelling. Also, the ligament tend to wear and tear off and result in osteoarthritis. The muscle of the geriatric also lose in muscle mass, and every periods of inactivity must be recovered by 2 weeks of exercising. For the consideration, in positioning, we must wait in patient on speed while positioning the patient. Don't rush the patient. We also have to use the immobilization aid to immobilize the patient that cannot position themselves in a static manner. We also have to take precaution to prevent fall by exercising the balance in transferring the patient from wheelchair to bed or from bed to wheelchair.
Next, let's move on to the knowledge, skills and attitude in handling geriatric patients. Firstly, when talking to them, we need to get their attention by touching their shoulder or call their name. Next, we need to have a good lighting in the procedure room so that the patient can see our face clearly when we are giving instruction. Speak to the patient with a clear and loud voice, but remember guys, do not shout. The most important is always check patient clinical history prior to the examination. And remember to treat the patient with respect and dignity. After all, they are our patient. We also need to remember to not pressure and push them, especially when positioning for any projection. And lastly, always remember to ask only appropriate questions to the patient so that they are comfortable throughout the procedure.